Hello, my name is Dr. Lauren Fine. I'm a board-certified dermatologist at Chicago Cosmetic Surgery and Dermatology, and I've been practicing for about 11 years. One of the most common conditions that I see in my practice is adult female acne. So it's sort of a misconception that only teenagers break out, and more and more adults seem to be struggling with acne, especially women. So adult acne, there are some differences, and we treat them a little bit differently. But some important things to think about are, what are the main causes of acne in adolescents and how they differ in adults. So some of the main drivers of acne tend to be inflammation in the oil gland, hair follicle unit, bacteria that live in the skin, abnormal keratinization or exfoliation of skin, and genetic factors as well as hormonal factors. In adolescence, the role of bacteria on the skin tends to play more of a predominant role than in adult female acne. So the main drivers of that I find of my adult patients are hormonal factors and even environmental factors, things such as stress that really can play a role in acne development. Acne in adults also tends to look a little different than acne or traditional teenage acne. For women, adult acne tends to be distributed lower down on the face along the chin and jawline area. These also tend to be more of the bigger, deeper bumps, less little whiteheads and blackheads. These often can be painful and red and sore, and women often notice every month a flare around their menstrual cycle or around the time of ovulation, and every month often in the same spots these big cystic-like lesions can appear. One other difference between adult acne versus teenage acne is that it often can take longer for acne lesions to heal in adults, meaning that we will often spots will go down and flatten, but these areas tend to form discoloration, and you can often find marks in areas where there have been previous breakouts, and that can sometimes take months to fade, even longer than getting rid of the active acne. So sometimes we refer to this as post-inflammatory hyperpigmentation or post-inflammatory redness. So that tends to stick around a lot longer in adults versus in adolescent patients. So the ways that we treat adult acne do differ a little bit. There are certain common ingredients that I think are really helpful for all types of acne. That being something called a retinoid. Retinoids are ingredients that have been around for many, many years to treat acne. They help with exfoliating and unclogging pores, and whether it's a whitehead or blackhead or a big cystic lesion, really all lesions start with a clogged pore. So that step is really crucial, I think, for all types of acne. But what retinoids also do, other than treating acne, it can help speed up the fading of discoloration that acne has caused. So doing multiple things at a time. Over time also just helps with overall skin tone and clarity. So many benefits of using a retinoid. Also good for anti-aging. So adult, that's always a concern for our adult patients as well. Some of the treatments that you find commonly at the drugstore or even in prescription products such as benzoyl peroxide or salicylic acid can be helpful, but I find that sometimes in my adult patients, benzoyl peroxide can be quite irritating. Also, benzoyl peroxide is really helpful at controlling the bacteria on the skin that can play a role in acne, and sometimes for women this is less of a main driver. And then finally, I would say some of the most important therapies for adult acne are therapies that are geared towards the hormonal aspect of these breakouts. So hormones in birth control or oral contraceptive pills can be helpful for some women, pills that contain a combination of estrogen and progesterone. But then there are other types of medications that can help block the effects of certain hormones on the oil glands themselves. And there has been a recently approved new therapy for acne, something called an anti-androgen that is going to be available on the market very soon. And there are other anti-androgen therapies that we have been using in dermatology now for quite some time, and for adult female patients that can make a big difference. One other important thing to think about in treating acne is often for patients even more of a concern than the active acne is treating the marks or scars that acne has left behind. And there are some ingredients, some products that patients can be using at home that can make a big difference, but also really important to be evaluated by a board certified dermatologist to think about best treatments for acne discoloration and acne scarring. If you have any other questions about therapies like this, you should be sure to visit your board certified dermatologist, and they can help you with that.